The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
Robust revenue and historic spending. Ontario released its blueprint for better times with Budget 2023. And tonight, for the full hour, we'll hear from the Minister of Finance, his opposition critics, and the province's independent financial accountability officer about just how well all those numbers add up for the people of Ontario. It's Thursday, March 23rd, and that's next on the agenda, our annual Budget Day edition. Okay, without further ado, let's get you into the budget package and share some of the numbers with you. Here we go. How do you spend $200 billion? We're about to tell you. Let's look at some of the important numbers in the budget, starting with Ontario's economic growth. Here's what the budget is forecasting. Quite miserly growth for this year, just 0.2%, but it gets better as we move along. 1.3% next year. And then in the two more out years, 2.5% and 2.4%, so heading in the right direction eventually. How about the deficit? That's one of the biggest stories in this budget. There's been a remarkable improvement in Ontario's economy. The deficit last year came in well better than they expected, only $2.2 billion. For this year, the Treasurer is banking on $1.3 billion in the red, but then 3 years ahead of schedule, a $200 million surplus in 24-25, and then a $4.4 billion surplus in 25-26. So much more buoyant times they anticipate coming. What's been one of the most difficult economic problems of the last couple of years? Yes, indeed, inflation. Forecast for this year, 3.6%. Next year, though, coming down to more traditional, at least over the past 3 decades, levels. 2.1% in 2024. 2% in 2025. Inflation looks to be, at least that's what they forecast, heading in the right direction. How about the big spending ministries for the 23-24 budget year? Healthcare, of course, always number one. $81 billion allocated for health spending for this fiscal year. That is 40% of all expenditures in the budget. Education comes in second at $34.7 billion. Children and social services at $19.4 billion. And how about this? One-time COVID funding is coming to an end. $0 in this budget specifically for COVID-19. Perhaps an indication that the pandemic, at least the financial approach to fighting it, is coming to an end. Let's do a few more budget highlights here. For example, the Homelessness Prevention Program and Indigenous Supportive Housing Program. There's $200 million plus assigned for that. Public transit infrastructure, we're looking at $70.5 billion over the next decade. And for highways, nearly $28 billion over the next 10 years for that. And one more significant program change, the GAINS program for seniors. That's an acronym for Guaranteed Annual Income Support. The income threshold is going to be raised in July 2024, and it should impact 100,000 more Ontarians on that front. How about the interest we have to pay on the debt of all the deficits we've accumulated in the past? $14.1 billion for that, making total spending $204.7 billion. Ontario's 2023 budget includes historic levels of spending, even as the province wraps up the one-time COVID-19 funding that ballooned budgets for the past 3 years. With us now on the government's priorities this year, from his office in the Frost Block, Minister of Finance Peter Bethlenfalvy, who's also the PC MPP for Pickering Uxbridge and Treasurer. We welcome you back to TVO. It's good to see you again. News tends to be what's new. So let's start with what's new. A balanced budget 3 years before you anticipated. Tell our viewers and listeners, if you would, what factors have gone into your being able to announce that today?
Well, great to be with you again, Steve. And, absolutely, we balanced 3 years faster than we thought even a year ago. And I credit that, a big part of that, to the economic engine of Ontario. You know, when you start to see the amount of building that's going on across this province, the amount of investments that are coming back to this province, you know, for example, Volkswagen, who's never invested in a major facility of any kind in Canada, chose Ontario for their giga battery manufacturing plant. That's a real vote of confidence in the Ontario economy. So when you have a growing economy and more jobs and people working and getting bigger paychecks, and of course that rises all boats, and we've been able to find that point where we can invest in the priorities of infrastructure and jobs in the economy, and at the same time have a fiscal plan to balance the budget 3 years faster than we thought even a year ago is a good thing for all of Ontario.
Well, your opposition critics would say that one of the reasons you're able to balance early is because you're not adequately funding things that needed to be funded. What would you say to that?
Nonsense. Nonsense. I mean, look at the investments that we're making, to support workers right across this province, including working with private sector labor unions to work arm in arm and funding new training centers so that we can train our skilled trades and our construction workers who have to build all these things. Look at what we're doing to invest in the Skills Development Fund. That's a fund where we're retraining and reskilling almost 400,000 people since we started a couple of years ago. Those are real jobs. Those are good jobs. People feel very rewarded by having these opportunities in the skilled trades, for example. We're also positioning our workers earlier in education. We're working with again, the grade 11 and grade 12 on the dual credit program so that, our children can, if they want to go into healthcare or be an early educator or a skilled trade, they can get credit in grade 11 and 12 for the courses that they take for post-secondary. It's things like that. So I say nonsense in education, nonsense as well in healthcare, an incredible investment in healthcare. We've got great people in our healthcare sector, but we have to keep building the infrastructure, give them modern facilities, and we have to continue to attract, healthcare workers, personal support workers, nurses, physicians, therapists, you name it. So I think we can do all these things, and we put an unprecedented amount of investment because, to have a strong economy, you have to have healthy people.
One more follow-up on this, and that is if you are, in fact, able to balance 3 years earlier than anticipated, and you are saying in the budget that you're going to have a $4.4 billion surplus 3 years from now, would you agree that you've obviously got lots of money to help out, for example, the City of Toronto with its budgeting problems, or maybe the school board with its budgeting problems, and so on, and so on, and so on?
Well, first off, we have to respect the taxpayer in this equation as well. So just let's not forget that we're also representing taxpayers right across this province, while at the same time funding like cities like Toronto right across this province. And let me point to an area where we've been very targeted and responsible in our investments and our spending. And one would be the announcement today for mental health and addiction support. That was the #1 ask of the big city mayors representing 70% of the population of Ontario. We've been through a heck of a pandemic the last couple of years, and mental health and addiction, we've increased the funding, not only the absolute levels, but also helping the community mental health providers increasing their base funding by 5%. A huge move. Now let's talk about supportive housing for homelessness and our homelessness prevention program. The City of Toronto said this was their #1 ask. They said, I met with the city, I met with John Tory, and this is an area that he was very, very active in, and we had numerous discussions. So supportive housing, supporting wraparound services for people who have had a tough break. We increased the funding there by $202 million per annum of new money. Toronto wanted $48 million. We gave them $48 million. It's going to help Ottawa. It's going to help London. It's going to help Oshawa. It's going to help, Guelph, Windsor, right across the province, because these are the types of things that we're going to do and continue to do in partnership with municipalities.
I know your government is big on electric vehicles, and you've already mentioned the Volkswagen initiative in southwestern Ontario, and there have been numerous others. There are, however, a lot of people who still drive internal combustion cars, and I note that the gas tax holiday that you imposed in previous governments is set to expire at the end of December. Is that to say we're going to see a gas tax increase January 1st next year?
Well, we're always looking at ways to make life more affordable. We have 8 million registered car drivers in Ontario, and a bit of a relief at the pumps when the cost of everything has gone up, is from I'm hearing from a lot of people is something that's very welcome. Inflation's coming down, but it's still high and really kicking in for people. So we're going to continue that measure throughout the end of the year. I look at also the environment that we've got to attract and build this economy so that that's the best thing. If we've got Biden coming up, today from the U.S., they're putting a lot of money into electric vehicle production in the U.S. We have just landed. You mentioned Volkswagen. We've landed a number of investments in this province where our manufacturing sector is coming back. And one of the things we announced in the budget was the manufacturing Ontario-made investment tax credit for private companies who are the supply chain for these electric vehicles. That's going to be so critical as we compete. We're not an island here in Ontario, so we've got to have the investment, support our small businesses and our manufacturing supply chain. This will really help places like Windsor and Oshawa and Brampton and now St. Thomas with the Volkswagen investment.
Let me ask you about seniors issues, and to that end, you are intending to expand the GAINS program. That's an acronym for Guaranteed Annual Income Supplement. 100,000 additional recipients by changing the threshold, at which point people become eligible for this. But I note that you're not imposing this until July of 2024, and presumably the need that they have identified is now, not 16 months from now. So why isn't it happening now?
Well, we're actually doing things right now, and you would know, Steve, that we've doubled that amount of support through 2023. So that's going to help people right now, and that started back in January. So that's in people's pockets. We doubled it so that they could get up to $1,000 additional dollars per person. A seniors couple who qualify, $2,000 in their pocket. Very, very important to support them. We also made another announcement as part of the expansion. On top of the 200,000 or so low-income seniors who qualify today, the additional 100,000 that you just mentioned that would qualify, but we're also indexing it to inflation. No government's ever done that. So there's a lot of things that we'll continue to do. That's just one thing that we're helping low-income seniors in this province. We're putting more money in their pockets by doubling the low individual family tax rebate that we announced last year. That's in there. You mentioned the gas tax. For the people on disability, we've increased the Ontario Disability Support Program, some of whom are seniors, increased that by 5%, indexing it to inflation. And by the way, we're doing all this while providing other services. Nothing gets clawed back. Nothing is impacting their benefits around. And there's many programs and services that we provide low-income seniors and many of the most vulnerable in Ontario.
I probably should not ask you this next question since it's a bit of a personal pet peeve of mine, and that is the amount of electricity subsidization that the taxpayers of this province are doing. And I note in the budget this year, it totals $6.5 billion, which is the highest ever. Treasurer, you and I earn six-figure incomes, and I don't know about you, but when I look at my monthly statement from Toronto Hydro, it actually gives me a $10 deduction on my hydro bill because the taxpayers of Ontario, or I guess you as the government, in your wisdom, believe in this subsidization of my power usage. I can tell you right now, I don't need it. I got a feeling you don't need it, and I got a bigger feeling that that money, for all the people who make six-figure incomes and who live in nice homes, they don't need it either. Why don't you get rid of that and put that money to something more useful?
Well, I'll tell you what, Steve, that's a pet peeve of mine, and I'll explain that. We have the situation because the previous government overpaid for power that we didn't need by some $33 billion. So I have a pet peeve as well. But I'll also say this, and I said this the other day on your podcast, now that we've tabled the 2023 budget, we start working on the 2024 budget, and I listen to all Ontarians, and that includes Steve Paikin. So I'll consider this the first budget consultation on TVO Today.
I'm not sure if we should regard it that way because that might put me in a bit of difficulty, but You know, I do wonder whether or not you think it is a sensible thing to subsidize power usage by people who make a decent income rather than, say, repurposing that money to a better idea. Do you think this is something you really want to tackle going forward? You've been in power 4.5 years, so I'm not sure blaming the previous government still holds water at this point.
Well, the legacy costs are still there, Steve, so I'm going to hold them to account as we navigate through this. But look, that's one aspect. You're raising the means testing opportunity on that. We're looking at the whole energy. We constantly are looking at the whole energy sector, and you know, we have another challenge that we've got to face, is that because of our growing economy, because we're building so much infrastructure, guess what we need to power that? Energy and electricity. So our needs are going to be significant, and so that's why, you know, we're investing in the electricity solutions for tomorrow, the small modular reactor that we're building in Darlington. That's why we're looking at you know, investing in battery facilities and building electric vehicles right across the province. That's why we're also, you know, I talked about in the budget, we're investing in the largest electricity battery storage facility in Canada in partnership with First Nations and others. So, you know, there's not just one and done on all these things. There's a bunch of things that we have to do. One thing I know is that we'll continue to look at all ideas, and you know, I don't mean to put you in a difficult position, but you are a citizen of Ontario, so I listen to good ideas right across the province, and so we're gonna, along with my colleagues, continue to focus on how we can be the most competitive, providing electricity, clean energy. By the way, we have a very clean grid. I went to Europe a few months ago. Germany would give their left arm for our clean energy grid, and in fact, that was one of the reasons that Volkswagen is coming to Ontario. We have one of the cleanest energy grids in the world. So we're going to not only, you know, we're not going to rest on the laurels. We're going to keep investing in that grid, and so, well, we've got a lot more to do, and we're listening to all Ontarians.
Down to our last few minutes here, so let me see if I can sneak in a couple of more questions. This one about health care. I know you and the Financial Accountability Officer, another guy named Peter Weltman, who's actually coming up on our program a little bit later. You guys tangle from time to time on how you see the world, and that's fine. That's all part of democracy. But I note in his most recent study, he said that the province of Ontario needs to create 4,500 new beds for hospitals over the next 6 years. And I note that you, in this budget, are allocating enough money to create 3,000, not 4,500, but 3,000 new hospital beds over 10 years, not 6 years. Why have you decided not to come close to what the FAO says is the target you need to hit if we're going to take care of our population the way we need to?
Well, you know, the FAO has a crystal ball, and they speculate on the future. And you know, I'll say this: we're responsible and accountable for getting it done, building the hospitals, building our healthcare system. We put a lot more money today into home and community care, long-term care, mental health and addiction, supportive housing that I talked about. But look, if you look at his report that said, here's government spending, this is what you need to do, that the FAO thinks, we're actually exceeding what they put in their report a few weeks ago. So I say, look at our numbers. And by the way, the Auditor General always looks at our numbers, and for the last 5 years has given us a clean bill of health. We're going to continue making the investments. The FAO's job is to project out, and you know, that's fine. But my job is to make sure that I deliver the investments for the hospitals, a 4% increase in base funding that I announced today. The increase in home and community care, including the contract rates, you know, some $569 million more a year of new money annually for the next 3 years to help with contract rates and stabilize the delivery of home and community care. Additional funding for mental health and addiction, including a 5% base increase that I know means a lot to the community mental health sector. Investing in our people, our nurses, our personal support workers, as of right, which we put in legislation if passed, will allow healthcare workers from across the province who come here to be able to work right away. We're cutting the red tape. We're making it easier to pursue your dream to be a healthcare worker. Starting in grade 11 and 12, where today I announced the dual credit program where you can take credits there in healthcare, and then they'll count for your post-secondary education. So we're doing a lot of things, and I'll stand behind our record any day.
In our last 30 seconds here, I want to ask you a bit of a weird question, admittedly, and that is, I don't know, I've probably seen 40 budget speeches over the years, but you did something today in the legislature I've never seen before, and that is you would announce a program, and then you'd point at somebody, and then you'd make another announcement of another program, and you'd point at somebody else. And I saw you do this several times today, and I thought, what's he doing? Well, I have this chance to ask you, what was that all about?
Well, if I did an announcement in the budget about supporting workers and a great workforce, I'd point to Monty McNaughton. If it was something in healthcare, Sylvia Jones, except she was very close to me, so it's hard to point right at her. I might hit her nose if I had pointed at her. Raymond Cho for seniors, Marilee Fullerton for youth leaving care. I mean, that's such a powerful thing. Michael Tabolo for mental health and addiction. George Peary for mining. You know, Steve, politics is a team sport. You know, you can't get very far if you don't have a team. And so I'm just acknowledging the many people in caucus, in cabinet, right across. And frankly, I acknowledge the federal government, and I thank them, and I think I pointed at the camera. So, you know, I don't know where that came from. You picked that up, and maybe that's a new tradition.
Gotcha. Well, we thank you for continuing our tradition on Budget Night, which is to have the Treasurer spend at least 18 minutes with us. Peter Bethlenfalvy, the Minister of Finance, the PC member for Pickering-Uxbridge, many thanks for joining us from the Frost Block tonight.
Always a pleasure, Steve.
Well, as we've said, Ontario will spend north of $200 billion next year. Not surprisingly, the opposition parties have questions. Here for their take on Budget 2023, let's welcome Catherine Fife, the NDP Finance and Treasury Board critic. She's the MPP for Waterloo. Stephanie Bowman, Liberal Finance critic and the MPP for Don Valley West. And Mike Schreiner, leader of the Green Party of Ontario and the MPP for Guelph. And can I just start by saying how delighted I am to actually have you three in here? Because how many times have we done this remotely? You guys in your offices late at night? Not you, I know you're new, but these two, yes. Anyway, it's great to have you actually here so that I can read this quote to you, Catherine Fife. You said, "You've never seen a party so gleefully celebrate mediocrity than this one today on this budget." How come?
Absolutely. I mean, I can't imagine being a government that actually has the revenue and has the resources to address the cost of living, the cost pressures that Ontarians are facing. So this budget missed the moment. And the fact that this government missed the moment means that they just haven't been paying attention. One of the #1 pressures that we are all hearing as MPPs across the province is housing. And Bill 23 is a piece of legislation that's on the books which removes development charges from municipalities, which will prohibit them from actually achieving the housing stock that's needed for the province of Ontario. And listen, for a budget like this, to not even mention the word autism is really an abdication of leadership, really, when you see what's happening in the province of Ontario right now. So this is a government that, you know, is very quick to pat themselves on the back. They shout out their own accolades at question period. We've all seen it. It's beyond annoying, and this is fundamentally an irresponsible budget when you're looking at the healthcare pressures, the education pressures, and even the mental health pressures.
Stephanie Bowman, what are you calling this budget?
Steve, you know, I'm calling this an underwhelming budget. It's a status quo budget that continues to, you know, drive forward on the favorite projects of the government, you know, building highways, talking about building homes, because again, they're not getting all that done, and underservicing the people of Ontario who need help around healthcare, education, facing opioid crisis and dealing with mental health addictions. And we have a climate crisis, which again is just not being touched at all here in this budget.
Mike Schreiner, you've called this a head in the sand budget. Why did you use that expression?
Because the budget ignores some of the biggest crises we're facing in Ontario, namely the housing affordability crisis. Matter of fact, their plans are actually going to make it worse, not better. The health human resource crisis that we're facing that's negatively affecting our healthcare system. Just the fact that so many people are facing poverty. People on Ontario Disability Support and Ontario Works are living with crushing poverty, the way the cost of living is affecting folks. And then finally, just the inability to address the climate crisis, and namely the effects that's going to have, the risk associated with people's homes and businesses, and the way it's going to negatively affect people's and municipalities' budgets. Let me give you one quick example. According to the Financial Accountability Officer, Climate change's effect to public infrastructure is going to cost an additional $26.2 billion over the next 7 years alone, just this decade. Nothing in this budget to help municipalities deal with the high cost of those infrastructure threats that are actually going to be made worse by this government sprawl agenda.
All right, let's dive a little deeper on a second round of questioning here. And I do want to talk about the deficit for a second, because they are, Catherine, crowing about the fact that they are going to balance the books 3 years faster than anticipated, and of course are taking a certain amount of credit for their financial stewardship in doing so. Are they entitled to do that?
No. I mean, and also this government uses the deficit, which is a moving target, and I'm glad that you're going to be talking to the FAO later on, because he's been tracking this. They use the deficit as an excuse not to invest. And they today in the House, when they said, we will balance the budget, all I could think of is that they're going to be balancing the budget on the backs of the most vulnerable people in this province. And that actually has greater costs. It has greater costs to the healthcare system, to the justice system, to the mental health system, and obviously to the education system.
Can I challenge you a bit on that?
Of course.
They are bringing in gains. They are making gains, the guaranteed annual income supplement, available to more seniors, indexing it against inflation.
It's $1,000 over the course of the year. When I talk to seniors in my riding, their rent is going up $300, $400. More and more women who are single are being evicted. There's no room in their budgets, Steve, to actually accommodate having no rent control in the province of Ontario. Without housing, without shelter, the downstream costs to the entire province far surpass a deficit. So when we talk about smart strategic investments, because the solutions are there for the province of Ontario, and we heard them actually at Finance Committee, it's incredible to me that the government failed to actually, any of those solutions resonated. But when we talk about the downstream costs, that hurts people. It hurts seniors, it hurts children in our education system. This is a government that has obviously a piece of legislation, Bill 124, on the books, which has been deemed unconstitutional. The government is fighting it in court, more wasteful money, that is actually driving our healthcare workers out of the province of Ontario. So out-migration is a huge issue, which is connected to housing and connected to wages, but the healthcare system right now, what Doug Ford is doing to the healthcare system should be illegal in the province of Ontario.
I would assume that a former official with the Bank of Canada would think it's not a bad thing to balance the books 3 years earlier than anticipated. What do you think?
Steve, balancing the budget can be a reasonable goal for a government given a certain economic point in time. I think what we need to think about right now, though, is that this government is balancing the budget when they have a contingency fund of $4 billion. So they're
Not for another couple of years. Right?
No, they're putting that in the budget this year, a $4 billion contingency fund. So they're balancing the budget to come in a couple of years, but they've got large contingency funds. So they don't need to balance the budget and underspend and underinvest in healthcare and education to do that.
But aren't they hanging on to that money in the contingency fund because in case Bill 124 goes south for them in the courts, they're going to have to find $8 billion overnight to pay all those people?
Yeah, so a couple things about that. I mean, this is a government that continues to, overpromise and underdeliver, right? Now, you could argue this budget might be a bit of underpromising so that they can underdeliver. We know that they put money in the budget and then they don't spend it. So this is, and they're underestimating tax revenues. They have a history of that. So this budget, I think, tries to catch up a little bit on that. So I think it's a little more reasonable in terms of their estimates for those things, but I think that's again evidence that they've got room to spend money with and still think about their fiscal responsibility.
I'm reminded that not everybody knows all these bill numbers, and Bill 124 is of course the one that held collectively bargained settlements, not so collectively bargained, to 1% over a 3-year bargaining period, and the court said it was illegal. So it's going through the system, and we'll figure out where that's going. Mm-hmm. You're a former small businessman, Mike Schreiner. Mm-hmm. Do I assume you're not hostile to balanced budgets?
Yeah, I can tell you, as a small business person, I understand the need to make investments to improve the performance of your business, and in this case, the performance of your province. Let me give you a couple quick examples. Poverty costs this province $33 billion a year. And yet this government is forcing people on Ontario Works, Ontario Disability Support Payments to live in legislated poverty. We'd be much better off bringing people out of poverty, saving that $33 billion for the province. Another quick example is we're subsidizing electricity prices at a tune of $6.5 billion. I
did ask him about that.
Did you? I'm glad you did, because that's more than most ministries receive in funding. It's one of the highest budget items in the entire budget, and disproportionately the benefits go to the wealthiest households in this family, in this province. That money should be redirected to help get people out of poverty, to address homelessness and housing. You know that every $10 invested in permanent supportive housing with wraparound mental health addiction supports saves the province $21.72. If we would be making investments in people, improving their lives, it will actually improve the fiscal performance of the province. But this government refused to make those kinds of investments in people.
He did say there was something in the budget today for wraparound supports. There was something.
Woefully inadequate.
Okay, you say inadequate, but there's something there.
See, $200 million, woefully inadequate for the scale of the homelessness crisis that we're facing in Ontario. And there's zero money for nonprofit and co-op housing. And most of the affordable housing that's been built in this province was built in the 70s and 80s, supporting co-ops and nonprofit housing. We haven't been doing that since the 1990s. Now we're at a breaking point. We need government to come back to the table with some funds to support that deeply affordable housing.
You want to come back on that, or can I go somewhere else?
The housing is the key piece, right? And so this government is stubbornly stuck with Bill 23. Bill 23 is obviously connected to the Greenbelt. Their own housing commission said they didn't need to go onto the Greenbelt to actually develop the housing. The not-for-profit sector in the province of Ontario is ready and willing to partner with the government, but they need someone to come to the table with the money. The other thing about Bill 23 is that, and this goes back to the cost of living, which this budget actually fairly ignores, is that property taxes are going to go up in the province of Ontario because municipalities need the infrastructure money to build the housing. And the government is, they're firmly in the pocket of the developers. And this is a sad state of affairs, actually, in the province of Ontario.
I know that the opposition's job is to oppose, but it's also the opposition's job to propose ideas they think are better.
Yeah.
So, okay, Stephanie, first chance to you. You saw what the budget did today. If you had a chance to put your blue pencil on it and change one thing, what would you do?
Yeah, well, I'm going to give you two things. So first of all, this budget is really leaving people behind. So we've got 50,000 Ontarians leaving the province because it's cheaper to buy a house in Alberta.
Yeah, but 275,000 are coming in. We're still ahead.
A lot of those are students, though. They're international students. So, we hope they stay. No, we hope they stay, but, we need to make sure we have the supports for them. They can't afford their rents today, right? They've talked about that. So the other thing is that, families, nothing in this budget helps families pay for their food, which we know the prices are going up 10% a year. We had proposed putting in a $50 extra per child into the Ontario Child Benefit for families earning $30,000 or less. So again, helping those who are most in need is really what, part of a government's job. The second thing this government isn't doing is, investing today to drive productivity and innovation for our future economy. So manufacturing, they've talked about, and we can talk more about that new tax incentive, if you like. But there are a lot of other industries that drive the economy in this province, and we need to be making sure that all of them are getting more productive, because productivity has been lagging in Ontario and in Canada for many years, and productivity growth is actually what improves our quality of life.
A new idea you'd have had in there had you been the treasurer today?
So we would be focused on people. And this is what we heard on Finance Committee, is that, the government talks about building beds. Those beds are just furniture unless you have the people and the nurses and the healthcare professionals. So
you mean hospital beds?
Hospital beds and education as well. So we would be completely and utterly focused on valuing and investing in the human resources, in the healthcare system, in the education system, and in the social services. Another example, which actually would save the province lots of money, is funding take-home cancer drugs. This has been an issue that we've discussed in the legislature. The government flatly denies that they will ever go in this direction. But why are we, making people who are very sick, actually have to travel when they can actually take those cancer drugs and stay healthier and be more comfortable? So there are solutions, especially around nurse practitioners for northern and rural communities. A nurse practitioner will take 900 people off of the wait list, and 2.1 million people do not have a doctor. So the solutions are there, and I think I think genuinely this is where this frustration comes from, is that you have a government that is so obstinately firmly attached to Bill 124 and Bill 23, and they are listening to select voices and not to the people of this province.
Mike Schreiner, a new idea from you.
Yeah, let's help people save money. Let's address the climate crisis and improve our economy at the same time. One of the best ways we can do that is through a building retrofit fund that would help people retrofit their homes, create thousands of jobs in doing that, and help them save money by saving energy and reducing climate pollution at the same time. And why we're talking about housing affordability, let's actually invest in affordable communities where people can live close to where they work and we don't sprawl out onto the greenbelt, because this sprawl agenda actually costs too much money. It costs a municipality over 2 times more to service a house built in sprawl like in the greenbelt than it does to actually build it in an affordable community where people actually want to live in homes they can actually afford. That's what young people want, and I think young people were forgotten in this budget.
Okay, at the risk of getting into the weeds here, I want to talk about contingency funds, which we did a little bit a second ago. Because it's true, there are billions upon billions of dollars being put into contingency funds, which are essentially a fancy way of saying rainy day funds. But Catherine Fife, I wonder whether you agree that if, for example, the Supreme Court comes back and says, you got to pay all these workers $8 billion, or if the City of Toronto, as we know they will, comes to the province and says, we need $1 billion to help balance our books because we're not allowed to run deficits, the province is going to have to find that money somewhere. Is it not reasonable that they've put some money in these funds for a rainy day?
So the biggest thing with the contingency funds is the lack of transparency. So even this government started off the year with $4.6 billion in a contingency fund. That $4.6 billion has steadily gone someplace. We as legislators do not know where it's gone. And so that's really undemocratic, quite honestly. It prevents us from doing our job. Around the court settlement, I mean, yes, the government brought in Bill 124. They violated collective and bargaining rights. The court deemed it unconstitutional. Doug Ford is still in court fighting that, wasting more money. So the first thing that Doug Ford should do is stop fighting nurses in the courts of Ontario, stop wasting that money, and then go back to the table and bargain in good faith. The nurses, teachers, all public sector workers want to go to the table. They want to have that engagement with the government.
Well, that's going to happen now, isn't it? Because I mean, it was a 3-year period that it was covering up.
Well, it has to happen. But how can it happen in good faith, Steve, when they're in court? I mean, really, unconstitutional legislation, government should not be wasting taxpayer dollars in court fighting unconstitutional legislation.
Same question to you. Is it not, their word is prudent, is it not prudent to keep billions in a contingency fund for that rainy day when it comes?
Well, again, you know, historically, contingency funds have been around $1 billion a year. This government has had record amounts of contingency funds, and as Catherine said, they are not being transparent about what's happening with that money. So I think we need to talk about transparency. We also need to talk about the need to spend money on things that we don't think that are adding to the value of our province. So, for example, building a new highway when we've got
you're talking about the 413?
Yeah, exactly. I mean, we are actually wasting an asset that we have here in the province of Ontario. It's called the 407. And I don't think waste is fiscally responsible. So when you talk about having very large contingency funds that, again, are, as you say, for a rainy day, well, you know, as many of us have been saying, the rainy day is here. We have crises in our ERs. We have teachers calling out for help because they have unsafe schools, because kids are dealing with, you know, serious mental health crises. And we have homelessness, you know, chronic levels in small towns across Ontario. We heard about it in the pre-budget consultations. We hear about it in big cities as well. So I think there are lots of things they could be doing with that money instead of putting it away in contingency funds, especially, as Catherine said, when they're fighting legislation that's unconstitutional.
Your view on that, Mike Schreiner?
I tell you what, people are hurting right now, Steve.
Yeah.
They are hurting right now, and how disrespectful is it of this government to have a contingency fund for some rainy day when people are hurting right now, when you have nurses who are overworked, underpaid, and disrespected by this government, and to say, oh, we have a contingency fund in case we have to do a payout of an unconstitutional bill that's restraining your wages, like, that's outrageous. And so, you know what? Let's invest in people. Let's invest in people now with the money we have available to improve their lives now, and it'll be good fiscal policy that's actually going to save the province money in the long run. That's where that money should go.
Okay, we got about 2 minutes to go here, and you know I do this every year, and I know you don't like it when I do this, but, you know, I feel some obligation to be somewhat balanced here. 2 minutes? Thanks, Tina. Okay, tell me one thing you liked in the budget.
One thing.
Come on, Catherine, you come up with one thing.
I know. I mean, I'm thinking. I do think. I mean, finally, for them to acknowledge that $200 million is needed for housing, because they have been stubbornly resisting investing directly in housing, and that is that. You know, listen, developers are not going to build affordable housing. They're in the business of making money by building housing. So we do need some direct funding in housing for attainable, affordable housing.
We saw some of that today. Okay, Stephanie Bowman, one thing you liked.
Well, they're talking about daycare. I like that they're talking about daycare. I wish they would actually act on daycare and help build nonprofit housing, nonprofit daycare, just like many groups are calling for. Canadian Women Chamber of Commerce, the Y has 35,000 spots. They only have 16,000 kids in there. So we need to actually have a plan for daycare instead of just talking about it, because that actually helps women, that helps families, and that helps grow our economy.
Mike Schreiner, last word to you.
Yeah, Steve, we have a shortage of veterinarians in this province, and there's a particular university called the University of Guelph that can help solve that problem. And I've been advocating for a program that would connect Guelph to Lakehead University to train more veterinarians, especially where there's a shortage in the north.
Yeah.
That was in today's budget, and I'm pretty happy about it.
And you got a heads up that it was going to be there. A little tiny heads up. Didn't he say to you, there's going to be something for Guelph?
There'll be something in Guelph, for Guelph in there. So.
Okay. Listen, let me reiterate what I said off the top. I'm really glad you could all come in tonight. I know your schedules are crazy, particularly on budget day, so the fact that you took the time to drive up to our studio or take the subway or however you got here is really wonderful. So thank you to Catherine Fife, the New Democrat finance critic, Stephanie Bowman, the Liberal finance critic, Mike Schreiner, the leader of the Green Party of Ontario. It's great to see you all here.
It's great to be here in person.
Amen.
Absolutely.
Thank you, Steve.
Now I got to go talk to him. So with that, let us move from the political commentary about this budget to the decidedly nonpartisan.
Sober second thought.
Did you just get appointed to the Senate? That's what they call the sober second thought. This is Peter Weltman. He is the Financial Accountability Officer for the province of Ontario, decidedly nonpartisan in his view of things, and is holding a copy of the budget. And he's going to join us now and give us his sense on the numbers. Okay, I'm just tempted to kind of tee you up for, what are you holding a copy of the budget there for?
This is the budget.
It is.
It's got a great cover. And the colors are terrific because the colors are FAO blue. And I think it's appropriate because I noticed in the government's forecast that the government's fiscal forecast is now finally converged on what we've been saying for the last year. So I feel pretty good about that.
The Treasurer has spent a lot of time disagreeing with you in public over the last year or two. So you think the fact that the cover of the budget is blue, you see him coming more to seeing things your way? Am I inferring too much?
I think it's a psychological inference maybe that they picked up on that. So.
Okay. We talked to you a couple of weeks ago on the On Poly podcast that I do with John Michael McGrath, and we went through 5 areas in healthcare that you and the FAO studied in depth to find out what the promises were and what the funding was, and you identified a $21.3, I think, billion gap between what they were promising and what they were funding. And then at the last moment I asked you, so what? And you said, well, the budget's coming out in a couple of weeks. Let's see if they help. Okay, the budget's out. How did they do?
Well, there's a whole bunch of new money in the budget, a whole bunch of new spending money, and it appears that they're really on track to what I would say right size the spending plan to line up with the promises that they've said that they want to do, the policies that they want to implement.
They talked, I think you talked about 7,500 new hospital beds, 4,500 of which would have to be built new, 2,500 repurposed. They had 3,000, funding for 3,000 in there. Not 4,500, 3,000. Do they get an F from you because of that?
Well, it's not up to me, right? So that's the fun part about this job. All we do is we point out and say, okay, if we look at the population of 65-year-olds, because those are the ones who occupy more than half of the hospital beds. That's just the way it is. And that population is growing over time. They're going to need more hospital beds out there to accommodate that population. If we're looking at 5 years, that's where we come up with our 4,500 number, 7,500 actually in total. The government had a plan in place to put 7,000 new beds in the 3,000 they promised, probably another 1,000 that they want to repurpose, and then 2,500 they want to free up by moving people to alternate levels of care. And we've said, At that time, remember, our report was a snapshot in time, and this budget is a new snapshot in a new time, where we've seen more money put into these programs to fund the policies that they've articulated.
But he didn't hit the numbers that you said needed to be hit. What do we infer from that?
That so two things. Either there's more work to do if they want to deliver the service in the same way, if they want to provide enough hospital beds for the 65 and over population and for the whole population of Ontario on the same basis that we've done in 2019, which wasn't great, by the way. We still have lots of hallway health care. However, if that's what they're trying to achieve, they're going to need to do a little bit more. If they have a different way of delivering health care, or they're trying some new things where they don't need to add those hospital beds, then, terrific. Let's see what it looks like.
Let's do more examples. You said that they are here funding long-term care beds, and they need to be here. Now, you've seen what they've put in the budget today. How much closer to the number they need to be at are they?
So on a gross basis, overall, it looks like as I said, they've done a pretty good job of right sizing. We won't actually know the detail sector by sector until we go and do our own analysis and publish our report in the spring, in May. But I think, to reiterate on that 30,000 bed commitment, so that would basically try to maintain the same wait list, the same number of beds per population as we saw in 2019. It won't reduce wait times. In fact, it won't quite get to the 2019 level. So if that's what they're trying to do, and they've added new funding, and we'll figure that out by the time we get our report out, then kudos.
I'm going to go through all 5 categories with
Sure.
you here, because you talked the other day about nurses. We need this many nurses, we have this many nurses, and they're not funding this many nurses. And PSWs, personal support workers as well. Okay, what'd you see in the budget today, and is it enough to go from here to here?
Well, again, I'll be able to answer that question specifically once we have a good look at the sector and the detail in the spending plans that will be published shortly. But again, on a basis, they've added $27 billion in new spending over the next 3 years for all programs, not just healthcare. And they still maintain a fairly sizable contingency fund and a sizable reserve. So it appears that there is enough money in the fiscal framework to start to address some of the shortfalls that we identified.
They did identify in the budget today money to deal with the surgical backlog. Enough to deal with all of it? Some of it? A tiny part of it? What?
Well, that's an interesting question, because they did allocate a bunch of money to surgical backlogs. A lot of it didn't get spent. I don't exactly know why that was. So adding more money to the pile, presumably if it gets spent and addresses the surgical backlog, that would be a good thing. But it's also important, from an accountability point of view, it's fine to say we're allocating the money, but it's also important to figure out at the end of the year, kind of either through our expenditure monitors over the course of the year or through the public accounts that is audited by the Auditor General at the end of the year, did that money actually get spent? And did it make an impact on surgical wait times?
You also, in your report, identified, I think you called them long waiters. These are people who had to wait. They're not only part of the backlog, but they've had to wait longer than is recommended by medical professionals to have their surgeries done. Do you think this budget helped those people at all today?
So again, we'll have to wait for the details. Clearly, if there's more money being put into something that the government perceives to be a problem, the problem is still there. The surgical wait times are still a problem. The long waiters, we figured so far, based on their success in getting that wait time list down, they're not going to make any difference on the wait times. Hopefully, we'll start to see some improvement in that area.
Okay, so that's healthcare.
Yes.
Let's take a look at the rest of the budget. Anything, as you read it, as you flipped through it, anything glaring jump out at you where you said,
Revenue. Unbelievable. Off the charts, crazy revenue numbers. Way, way higher than we've seen in that I remember. We're in a situation where we've had strong economic growth. Our labor report that we released earlier this week showed that we've had the strongest employment growth in Ontario 2 years in a row, the strongest 2-year growth we've ever had before. Record unemployment rate, 5.1%. Big job vacancy.
record low, you mean?
Record low, that's right, record low. So the economy is really strong, and we've had inflation. So inflation on top of that, unusually high inflation, and all that does is it just adds a whole bunch of cash to the government coffers.
Okay, you know how much you don't like to answer political questions. You know how much I like to put them to you.
Absolutely.
So let's try this. Are they entitled to take credit for those buoyant revenues?
So, they can do whatever they want. They're the government, right? So that's the advantage of being in government when times are good, is you get to take credit. I think at the same time, they were in government when the pandemic hit, so they got their fair share of grief as well. And that's just the nature of being, to some degree in the right place at the right time. To some degree, there might be some policy action that may have helped that. Very tough to draw the line between the two, but I can tell you, we haven't, we've record high inflation the last 40 years. We haven't seen this. We've had incredibly strong economic growth, and that in and of itself contributes a ton of money to revenues.
Should we be comforted by the fact that they have forecast inflation to come back to about 2%, where it was for 30 years after all, in just a couple of years' time?
Well, that's a forecast, and we're not too far off of that. So I would have to say, to defend our crystal ball against their crystal ball, the crystal balls are converging a little bit. But we have seen inflation come down. We've seen prices come down in commodity prices, gasoline. A lot of stuff has come down, but people don't see that because most of the time they're thinking about food and they're thinking about their mortgage. And those are two huge issues that haven't. They've gone up and they're still high.
Since you mentioned crystal ball, he did take a bit of a shot at you in the interview. I'm talking about Peter Bethlenfalvy, the other Peter. He took a bit of a shot at you in the interview that he did with me, saying, I know the FAO's got his crystal ball. And he seemed to be, unless I was inferring something that wasn't there, and I don't think I am, he seemed to be suggesting that you're no better able to divine the future than he is. What did you think?
Well, I thought, the context of the question was in the healthcare report, of our healthcare report. So our healthcare report isn't about crystal ball gazing. Our healthcare report is about math, right? How many beds? How much does it cost? How many are we going to need? What is inflation? What is the rate of demographic change? Do the math, project out. There's your number. Government says they want to build 4,000. That's what they cost. Government has allocated X dollars. Oh, it's not enough money. There's no crystal ball gazing there. It's math, and it's also about the government's planned spending versus what they need to spend to hit their objectives.
Just out of curiosity, do you have the kind of relationship with the other Peter whereby after you leave the studio tonight, you could call him up and say, about that crystal ball shot you took at me? Just curious.
Oh, well, sure. I mean, I won't because, he's been through 23 interviews so far, and this is only my only one. So he's going to be a little tired out. But in due course, if we want to chat about it, we can chat about it. But we do have a good relationship. I do with many ministries in terms of if I think we're going to come out with something that might be a little bit confrontational or might, our job is, as I say, is to shed light, not heat. So if I think there's something that's going to shed heat, I'll put something out and say, listen, there might be something there you guys are going to, have to figure out on how you're going to manage it. But this is the way it is. I'm the referee. I call him as I see him, and that's the way it goes.
You're a numbers guy. So when you look at the budget and you see that the budget is going to be balanced, that's what they forecast, 3 years earlier than anticipated, how do you react?
3 years earlier than they anticipated.
Yeah.
We called for an almost balanced budget this year, right? So like I said, their numbers are starting to converge on our numbers. So we're certainly we were there a long time ago. What I find interesting is the size of the surplus going forward.
4.4 billion 2 years out.
That's 4.4 after taking into account a $4 billion reserve, right? So that reserve isn't actually money that's appropriated. That's a planning figure so the government can get everybody focused on the 4.4, and that's what they're shooting for. But if you add that $4 billion back to that 4.4,
this is the money that was in the contingency fund we talked about.
This is the planning reserve. We'll talk about contingency.
Right. Okay.
Two different things. So the reserve is a planning figure, and what that does is it gives them some flex in case they need to go back and ask for more money. But if you add that, when we don't take that into account in our forecast. So if we're looking at that, we're looking at an $8.4 billion potential surplus in 3 years from now, not 4.4. If everything goes, according to forecasts, which of course they don't always do, right? So it's significant.
That's
a lot
money.
more than we're actually forecasting. We're forecasting 5.3.
Tell me something. On a budget that spends $200 billion, and you've got a deficit of about $2 billion, that's a rounding error on that kind of a budget,
right.
isn't it?
Yeah.
So why bother? Why not just balance this year?
Well, that's a good question, for the government. It's not our budget. We just do the analysis, but it's effectively zero. I mean, that's how we look at it. It's a rounding error. And there may be reasons they may still balance this year. There may be expenditures that they thought they'd have to make that they don't have to make. There may be increased revenues coming in, even though, they forecast a higher revenue. But remember, their snapshot in time was around, end of February-ish when they put pens down and they had to print this document with the nice FAO blue color on it. So at that point, that's locked in. We will have the advantage of having a little bit more up-to-date forecast when we come in, and up-to-date economic numbers when we come out with our report in May.
This snapshot in timeline is something that I hear him say it about you all the time.
That's right.
That you're just looking at numbers at a snapshot in time, and therefore we ought not to pay too much attention to it. Are you using that expression back at him now? Because
is it that obvious?
I don't know if it's obvious, but it's more than a coincidence. I think that you've said it 3 times so far.
It's true. Both of our work are snapshots in time. I mean, and things change, right? They do their budget. We'll do our economic and budget outlook in May. So we have the advantage of having slightly more up-to-date figures, and they'll come out with a fall economic statement. They meaning the government. And they'll have more up-to-date economic numbers than we would have had. So it's a rolling thing, and and it's great for taxpayers, citizens, because 4 times a year they get to see how things are progressing and how the forecasts change.
Right. Now, one thing the Treasurer did say today is that the deficit number for last year was, a minute to go? We got a minute left. Was way better than they anticipated. So everybody's powers of prognostication are not necessarily the best when there's a war in Ukraine and inflation's doing what it's doing. And so how much of today's budget, how much of that document do you think we can take to the bank over the next 3 years?
Well, it's tricky. It's tricky. We'll know better once we have a good chance to look at it. As I said, their numbers are getting a little bit closer to ours, but there's some pretty high revenue forecasts in there that I'm going to take a second look at. I'm thinking they're looking a little high, but we do have all these other uncertainties. A war in Ukraine, we have inflation, and all those will have an impact down the road. They'll make us both wrong. So.
Gotcha. Thanks for coming in tonight.
Well, thanks for having me.
This is a real pleasure.
Tonight.
Yeah, we've talked lots in the past, but this is the first time live at 8:59 p.m. here in the province of Ontario. So thanks a lot. That's Peter Weltman, the Financial Accountability Officer for the province of Ontario. And that is the agenda for Thursday, March 23rd, 2023. For more of TVO's budget 2023 coverage, you can always check out our website. That's TVO.org, which includes columns from yours truly and my On Poly podcast co-host, John Michael McGrath, with whom you have the same birthday, I think, which is kind of weird. Okay, tomorrow, Nam Kiwanuka talks to London, Ontario Mayor Josh Morgan about why his city's approach to solving homelessness has already gotten a lot of praise. I'm Steve Paikin. Thanks for watching TVO, for joining us online at TVO.org, and Nam, we'll see you here tomorrow.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.